I want to talk about medicine. Not in the abstract, not medicine has improved. In the specific, in the concrete, startling, sometimes funny, sometimes sobering specific of what medicine was in 1947 and what it will become by 2026. I have been using the device to read about this for weeks, before the battery ran out, and I have been continuing with books since. And what I found was, the distance between what we know and what will be known is not the distance of refinement, not the distance of getting a little better at something we already understand. The distance is the distance between a different kind of knowing. Let me start with something that happened in my lifetime, and that I want you to understand was considered, at the time, a significant medical achievement. In 1949, this year, the year I am in right now, the Nobel Prize in Physiology or Medicine was awarded to Antonio Egas Moniz for the lobotomy. I want to say this clearly, because saying it clearly is the only honest way to say it. The Nobel Prize, the highest scientific honor in the world, was awarded this year to the man who invented the practice of cutting connections in the front of the brain as a treatment for mental illness. The lobotomy. The procedure, in its most common form as practiced in the United States by Walter Freeman, involves inserting an instrument, in Freeman's transorbital method, an ice pick-like tool, through the eye socket and into the brain, and moving it to sever the nerve fibers connecting the frontal lobes to the rest of the brain. This is currently being done in hospitals, by doctors, to people with schizophrenia, with severe depression, with anxiety disorders, to people who were not responding to other treatments, to people whose families could not manage them. Sometimes, frankly, to people who were simply inconvenient. Approximately 40,000 lobotomies have been performed in the United States since the mid-1930s. The procedure often produces what the doctors describe as positive results. The patient becomes calmer, less agitated, more manageable. What the device's information showed me about what we will come to understand about this, the procedure was destroying the brain's capacity for complex thought, personality, and the specific quality of being a full person. The calmness was not health. The calmness was damage. And the Nobel Prize was given for it. In 1949. This year. I want you to hold this as the frame for everything I am going to say. We are giving the Nobel Prize to the lobotomy. This is where medicine is right now. Not because the people doing it are evil. They are not. Most of them believe they are helping. The treatments they have available are limited, and desperate circumstances call for desperate measures. But we are wrong about this. In 2026, the lobotomy is understood as one of the most harmful things that medicine inflicted on its patients in the 20th century. We do not know this yet. I want to talk about smoking. Not about smoking in the way I discussed it in episode 16 of First Times, in the context of Bogart's esophageal cancer, the specific consequence for one person. About smoking as a medical question in 1949. In 1949, the relationship between smoking and cancer is not established medical consensus. There are researchers who suspect a connection. The epidemiological data is beginning to accumulate, but the medical establishment, the doctors who see patients, who recommend treatments, who are the professional arbiters of what is healthy and what is not, the medical establishment is not saying smoking causes cancer. The American medical establishment is saying cigarettes are fine. Not just not warning, actively endorsing. The Camel cigarette advertisements, which I described in the First Times series, the ads I found most disturbing in the advertising episode. Those advertisements say, more doctors smoke Camels than any other cigarette. This is not a cynical lie. It is being said by people who believe it, or who have insufficient reason to disbelieve it, or who are being paid to say it, or some combination of the three. The device showed me what we will know by 2026 about smoking. Smoking causes lung cancer. This will be established definitively by the U.S. Surgeon General's report in 1964. Smoking causes heart disease. Smoking causes stroke. Smoking causes dozens of other cancers. Smoking kills approximately 1 in 2 smokers who smoke their whole lives. 1 in 2. Half. And in 1949, more doctors smoked Camels than any other cigarette. I think about Jack. The pack of Camels on the table at Connolly's. The bar full of smoke. Me, sometimes, when the evening calls for it. The device showed me the consequence. I have been thinking about how to say this to Jack. I have not found the words yet. Here is a piece of medical history that I want to describe, because it is instructive and because it is, in the darkest possible way, funny. Ignaz Semmelweis. Semmelweis was a Hungarian physician, a doctor in Vienna in the 1840s, who noticed something about maternal mortality in the hospital where he worked. The hospital had 2 maternity wards. In one ward, run by medical students, the death rate from puerperal fever, childbed fever, the infection that killed women after giving birth, was approximately 10 to 15%. In the other ward, run by midwives, the death rate was approximately 1 to 2%. The same hospital. 10 times the death rate in the ward run by doctors. Semmelweis investigated. He found that the medical students came to the maternity ward directly from the autopsy room, from performing dissections on cadavers, without washing their hands. He proposed a solution. Wash your hands. Specifically, wash your hands with a chlorinated lime solution between performing autopsies and delivering babies. The death rate in his ward fell to approximately 1%. He had discovered, without knowing the mechanism, without knowing what germs were before germ theory had been established, that something was being transferred from dead bodies to living women on the hands of the doctors, and that washing removed it. The medical establishment's response? They rejected him. They ridiculed him. They said his data was wrong, his methodology was flawed. The idea that doctors could be causing the deaths they were supposed to be preventing was offensive to professional dignity. Semmelweis was eventually committed to a mental institution. He died there in 1865 of an infection, possibly contracted from a patient or from a wound he received during one of his final examinations. The infection killed him, the thing he had spent his career trying to prevent. Now, hand washing is the foundational practice of medicine. Every doctor washes their hands. Every surgery requires sterile conditions. Every hospital birth involves antiseptic protocol. The thing that Semmelweis proposed in 1847 and was institutionalized for, now understood to be correct. The thing that the medical establishment knew in 1847 and defended professionally, known to have been killing patients. I think about this when the medical establishment tells me something, not with paranoia, with calibrated humility. I described penicillin in episode 3 of First Times, the 3 days instead of 3 weeks, the specific miracle of the antibiotic applied to my strep throat, the thought about my grandmother who died at 52 of an infected wound. What the device showed me about what comes after penicillin: more antibiotics. Many more. The discovery of penicillin in 1928 and its deployment beginning in the 1940s opened a door that scientists walked through enthusiastically. By 2026, there are dozens of antibiotics targeting different bacteria using different mechanisms, effective against things that penicillin cannot touch. This is extraordinary. And then, what the device also showed me, which is less triumphant: antibiotic resistance. Bacteria evolve. This is what bacteria do. They reproduce rapidly, and in the reproduction, random mutations occur, and some mutations produce resistance to the antibiotic that was killing the previous generation. And those resistant bacteria survive and multiply, and eventually the antibiotic that was effective becomes less effective or ineffective entirely. By 2026, antibiotic resistance is described as one of the major threats to global health. Bacteria that were easily killed by antibiotics in the 1950s have evolved resistance to multiple antibiotics. There are bacteria in 2026. They have a name in the device's information, superbugs, that are resistant to almost all available antibiotics. The miracle that saved my grandmother's generation is creating conditions for a different crisis in the generation of my grandchildren's grandchildren. This is not reason to not have used the antibiotics. It is reason to use them carefully, which the device's information suggests we have not always done. We will give antibiotics for viral infections, which antibiotics cannot treat because patients expect to receive something. We will put antibiotics in animal feed because they promote growth in livestock. We will use them liberally because they are available and cheap and effective. And the bacteria will evolve. The miracle produces the problem. The problem will require the next miracle. In 1949, if your heart fails, you die. Not always immediately. There are conditions of the heart that progress slowly, that allow time before the final failure. But the heart, as a mechanical pump, when it stops pumping adequately, there is nothing to be done about the mechanical failure. There is no medicine that repairs the broken valve. There is no device that can substitute for the failing muscle. The heart fails, and the person fails with it. The device showed me. 1953, the first successful open-heart surgery using a heart-lung bypass machine. A machine that takes over the function of the heart and lungs while the surgeon operates on the stopped heart. Operating on the stopped heart. The heart, stopped deliberately, while a machine does its work, while a surgeon cuts and repairs and closes. And then the heart is restarted, and the person lives. I want to sit with this for a moment, because this is one of the things from the device that required the most sitting with. The heart is the center, not in the sentimental sense, in the physiological sense. The heart is the pump that makes everything else possible. To stop the pump, to operate on it while it is stopped, to repair it, to restart it, this is the kind of thing that sounds like the premise of a science fiction story. By 2026, routine surgery. Not simple. There is no such thing as a simple open-heart surgery. But routine. Performed daily in hospitals around the world, tens of thousands of times per year. And further, by 2026, there are artificial hearts. Not in every hospital, but in specific cases, when a person's heart has failed beyond repair and they are waiting for a donated heart for transplant. An artificial mechanical heart can sustain life for weeks or months. A mechanical heart, outside the body, pumping the blood, the person living. In 1949, if your heart fails, you die. In 2026, we are thinking about how to do better. I described Semmelweis above, the man who proposed hand-washing before germ theory was established and was ridiculed for it. I want to explain germ theory because germ theory is the foundation of modern medicine, and its establishment was not obvious. Before germ theory, miasma. The miasma theory of disease held that illness was caused by bad air, the specific foul air produced by rotting matter, swamps, poor sanitation, the general unpleasantness of disease environments. The association between certain environments and disease was accurate, Swampy areas did produce more malaria. Poor sanitation did produce more cholera. The mechanism was wrong. Not the air, the organisms in the water. Germ theory. The understanding that specific diseases are caused by specific microorganisms, and that preventing and treating disease requires preventing and treating the transmission of those organisms, was established largely through the work of Louis Pasteur and Robert Koch in the 1860s and 1870s. Once established, everything changed. The specific sanitation reforms that transformed mortality in cities, not because of improving the air, but because of providing clean water and removing sewage. The specific antiseptic techniques of surgery that allowed operations to stop being death sentences. The vaccines that prevent rather than treat. All of this, possible because of germ theory. And yet, in 1949, 80 years after germ theory's establishment, there are still things we are doing that are wrong about disease. We know about bacteria. We are only beginning to understand viruses. We do not yet understand, in 1949, in the way that 2026 will understand, the role of the body's own immune system in disease and health. We do not yet understand the microbiome, the specific community of microorganisms that lives in and on the human body, and that is, by 2026, understood to be essential to health in ways that are still being discovered. The body is not a machine that gets infected by pathogens. The body is an ecosystem. In 1949, we are still primarily thinking of it as a machine. In 1949, cancer is understood as a growth, a malignant growth, cells that have somehow become abnormal and that grow without the normal controls on cell growth, that invade surrounding tissue, that can spread through the body. The treatment? Remove it surgically if you can. Irradiate it if it is accessible to radiation. Hope. What the device showed me about what cancer is and what will be understood by 2026, cancer is a genetic disease. Not a disease you catch. A disease that occurs when the genetic material within cells is damaged in specific ways that disable the normal controls on cell growth. The damage can come from many sources. Exposure to carcinogens like cigarette smoke, radiation, certain viruses, random copying errors when cells divide. By 2026, the specific genetic mutations that cause specific cancers are being identified and cataloged. Treatments that target these specific mutations, not the blunt instrument of radiation that damages healthy cells as well as cancer cells, but targeted therapies that address the specific molecular malfunction, are in development and use. By 2026, some cancers that were death sentences in 1949 are treatable and survivable. Childhood leukemia. In the 1950s, a diagnosis with very poor survival rates. By 2026, more than 90% survival with treatment. Testicular cancer. In 1949, nearly uniformly fatal. By 2026, one of the most treatable cancers, with survival rates above 95% if caught early. These are specific, named, real improvements, and some cancers remain, by 2026, still very difficult. Pancreatic cancer, glioblastoma, a specific brain cancer. These remain challenging in 2026 in ways that reflect how much more there is to understand. The distance between 1949 and 2026 on cancer is enormous. The distance between 2026 and the full understanding of cancer is still large. I want to tell you about something that is about to happen because it is one of the most significant medical events that will occur in my lifetime, and I know it is coming. The polio vaccine. Poliomyelitis. Polio, the disease that paralyzes, that attacks the nervous system, that kills some of those it infects and leaves others with partial or complete paralysis, that produces, in its most severe form, the inability to breathe without a machine, the iron lung, the specific apparatus of a person's head outside and their body inside a metal cylinder that breathes for them. In 1949, there are thousands of iron lungs in use in the United States. Thousands of people, most of them children, because polio preferentially attacks children, lying in iron lungs because their respiratory muscles cannot work without assistance. In 1955, 6 years from now, Jonas Salk will announce a successful polio vaccine. By 1979, polio will be eradicated from the United States. By 2024, it will be nearly eradicated globally, existing only in 2 countries, and those countries are working toward elimination. The iron lung will become a museum piece. The children in iron lungs right now, some of them will live long enough to see the disease that crippled them eradicated from the earth. This is one of the things the device showed me that I have been holding since. The children in iron lungs right now. The vaccine that is coming. The eradication that will follow. This is what medicine can do at its best.